Hi, I'm Terry Kimball with the Chandler Chamber, and I am so excited to bring you today's program. Today, this is part of our Strategy for Success series and brought to you in part by the City of Chandler and the Industrial Development Authority. But today, I have with me two very special guests, and you're going to get to hear from them in just a moment. But today's topic is preventative measures and pivoting your well-being. And I have joining me here today Dr. Hassan Khan with the American Medical Associates. And thank you for being here. And we also have Cheryl Morales with Vitalize Infusion Center. But I want to give you a little bit of background about Dr. Khan. He is an internal medicine physician here in Arizona for over 15 years. And he is currently serving as the medical director at the American Medical Associates. He completed his residency in 2008 from Lutheran Medical Center in Brooklyn, New York. So he got smart and came out here for the great weather. And years later, he actually was at the University of Arizona in Tucson, where he completed his fellowship in nephrology. And Dr. Khan is an attending physician credentialed at both Dignity and Banner Health System. He's also the primary staff at American Specialty Orthopedics Hospital and Oasis Orthopedics. In addition to treating his patients with kidney disorders, Dr. Khan also enjoys teaching medical students in his residency at Mercy Gilbert Hospital. And if that's not enough, Dr. Khan is very energized and is with his fast-paced wife, who is also a physician. I love that. So talk about a power couple there. And I love that you've started your own business and that you're continuing to really embrace this whole during COVID, and you're continuing to educate people. And I will tell you, I've had the opportunity to meet with your staff, and I love just the energy the culture that you've created at American Medical Associates. So thank you so much for joining us.
Sure. Thank you so much. This is Dr. Khan, I'm an internal medicine and nephrologist here at American Medical Associates. So glad I could be here with you and the viewers. Today we'll be talking about many, many different things, especially in this environment that we're in with this pandemic or whatnot. The preventative measures have really become pretty vital when it comes to basically, taking care of ourselves. One of the key factors that I really want to focus on today is, of course, you have many, many medications that are out there that we take to fight different types of viruses. But what's important is how is it that we can actually strengthen our own immune system? How is it that we can strengthen our own bodies so they can naturally fight these viruses much better? And that's one of the key things that we'll be talking about at this point. So a couple of things, we will be talking a few things that you already know. One of the things is, about what viruses are. My goal is that by the end of this presentation, you'll know a little bit more than we normally hear and what you normally see on Google. So viruses are basically strands of DNA, RNA that incorporate themselves into the DNA and RNA of the host cells. They do not have the capacity to thrive on themselves, but once they're able to incorporate themselves into a host cell, at that point is when all the damage starts. These viruses can survive on even dry surfaces for a very, very long time. What are some of the symptoms that patients can have when it comes to the viruses? Well, people can get, fevers and chills. You can have some pretty non-specific symptoms. You can have these myalgias, arthralgias, which is, people can have a lot of muscle aches, pains. These are actually some of the more common complaints that you will hear. People can have generalized weakness. They just don't feel well. That's really what it comes down to. People, obviously, when the people are getting sicker, they can get fevers, chills. Of course, depending on the type of virus, you could get some coughing, sneezing, or whatnot. Some of the GI viruses definitely can cause nausea, vomiting. You have some of the more respiratory viruses, for example, the influenza, even COVID. They can cause the swelling and inflammation of the respiratory airways. They can cause throat swelling and so forth. Many of them can cause actually lymphadenopathy, which is basically swelling of the lymph nodes. And again, this is a reactive response, is a reactive inflammatory response that you get from the body. For that, they can have body aches. So these are some of the things that you'll get. Again, the symptoms from the viruses vary depending on the type of viruses that's involved. Hepatitis virus does not act the same as HIV, or for that matter, like COVID, or influenza for that matter. Um, so again, different names that I just told you. Again, viruses can be anywhere between chickenpox, herpes, meningitis, hepatitis, or whatnot. And of course, the viral pneumonias, is in other types of viruses that you'll see. Um, Now, how do the viruses spread? Now, this is pretty important part, because I'm sure many of you all have seen some pretty prominent figures in the field of infectious disease on TV. I'm sure you all have seen many presentations, and these are all about how these viruses, especially respiratory viruses, how they can spread. Of course, there are many bloodborne viruses. You have, things like Hep C. You have HIV. Some of these are, there needs to be a lot more contact between two individuals, and sometimes really, blood exchange, or other body fluids need to be exchanged before they can spread. Respiratory viruses are not really bound to that. Viruses like influenza, they can really be, they're airborne, and they can be, these airborne droplets can get contaminated with the virus, and they can spread very easily. Some of the GI viruses, some of these viruses that can cause gastroenteritis, they basically enter our body with foods and drinks, contaminated foods and drinks, rather, for that matter. And, so it really depends on the type of viruses. One thing is for sure, however, that these viruses actually can survive for a while, on dry surfaces, unless, of course, there's proper care being taken, and disinfectants are being used to treat those surfaces. These viruses can't survive there. And of course, when it comes to personal hygiene, I'm sure you've heard this 1,000 times, washing hands, and definitely helps a lot, because then you're actually able to wash off some of these surfaces, and preferably with some antibacterial soaps, or any other soaps that are specially designed for this use. They can be used for this. But yes, these are some of the ways that viruses spread, and that's how we can tackle this. This is why you see so much emphasis on face masks, because of the COVID-19, influenza, a lot of these respiratory viruses spreading by that manner, by that route. And that's exactly what we want to tackle. That's what we want to make sure that we take care of that before it spreads. So risk factors, well, the risk factors are there. Of course, we know that, in older people in general tend to be more susceptible. Younger patients tend to fight off viruses better. Of course, if someone has some coexisting factors, for example, if we're talking about patients who have some other chronic lung diseases, like if they have COPD, if they have chronic asthma, or if they have other pulmonary conditions like pulmonary fibrosis or other problems, then in those cases, obviously, they're much more susceptible to some of these respiratory viruses. And what's worse is that these patients actually get much sicker when they do get them. Some of the younger patients can get it and they can fight it off, or they might get a bad bronchitis, and that's pretty much it. They'll recover. Some of these older patients who have a lot of these comorbidities, they'll get it, and guess what? They're going to go ahead and get a straight up pneumonia. And some of these pneumonias are going to be bad. Many of these patients are going to end up in respiratory failure. Many of them are going to require ventilation support. So this is serious, and we do need to understand that some of these comorbidities really do play a role. Same thing with the cardiac patients. If someone has underlying congestive heart failure, or they have underlying other cardiomyopathies, it really does matter that some of these people will be more susceptible, and they can get worse when it comes to getting some of these infections. Um, let me see here. So prescriptions, medications, this is a really important part, and I do want to touch on this a little bit. Um, in the past, and of course, especially say with the influenza virus, we've had Tamiflu, and there have been other medications that are around. Of course, in this very charged environment with the pandemic and COVID-19 being the way it has been around, the issue has been that the therapies that are there, they're pretty hardcore. I mean, you have remdesivir, you have a convalescent plasma, all these therapies, and I should rather say heavy duty therapies, they're pretty much limited to the hospitals. The reason is that they have to be monitored, they have to be given in a very specific way. Physicians have to monitor blood labs pretty much constantly. Every single day, we take a look at their blood labs to make sure that their organs are working fine while they're getting all these therapies. So this is not exactly something very, very benign, and we have to be extremely careful when we use them. So that's where what matters is that what we can do to actually strengthen our own bodies so our own body can fight some of these viruses much better. Because we don't exactly have a day-to-day antiviral therapy for some of these viruses, especially COVID. Um, and just one thing I want to clarify, now that it's necessary, that a lot of people, antibiotics do not work on viruses, folks. So I just want to be clear about that. Yes, people can get secondary infections, and if someone gets a secondary pneumonia and the primary infection was a viral, then I can understand giving antibiotics, but they should not be used as the primary medication when a viral pneumonia or a viral infection is suspected. And again, we're more specifically talking about the respiratory viruses. Of course, if we're talking hepatitis or some of the other ones, then the therapies targeted towards those viruses should be pursued. Um, and so one of the things that, as we talked about, as I was just talking about how to make our system stronger, one of the ways, of course, to make our system much stronger is to get vaccinated. Um, and here in the picture, you can actually see Dr. Nadir. She was getting a COVID vaccine at that time. I myself have gotten it. I definitely I encourage our viewers, our patients, to, unless there's a contraindication, to go ahead and get vaccinated for whatever they might be getting exposure to. For example, I've always encouraged the flu vaccine. I definitely encourage the COVID vaccine. This is to, of course, prevent any complications down the road, and of course, make your body stronger.
Okay, Dr. Hahn, I'm going to have you stop right there. I have a question for you.
Sure.
All right, mask. You talk about the importance of wearing masks, whether for many different reasons for viruses. Should you wear a single mask or a double mask?
So, that's a very legitimate, and that's a very good question. I think what I would respond by that is it depends on what type of mask it is. Now, if someone is wearing an N95 mask, one mask is more than enough. As long as it's being put on properly, it should be fine. There are, of course, if someone wants to get some of those more heavy duty respirators, we see a lot of those in the hospital because we're dealing with a lot of COVID patients there. So, of course, in that kind of environment, that's understandable. I myself have, a full blown respirator that, in sick or COVID patients, then that's what I use in there. Otherwise, in the rest of the hospital, we usually use the N95s. Now, for regular day-to-day use, I definitely recommend a regular mask at an absolute minimum. I do like the N95s. I think they're great. I think they're more effective. But, I have heard from patients that some of them find it a little bit uncomfortable. And, realistically speaking, if they're not going to put it on because it's uncomfortable, then I would rather at least have them have a regular mask on at a minimum. So again, in reality, if I wanted to, if it was up to me, yes, a regular mask, and if possible, a cloth mask on top of that would be nice. However, like I said, many of people, there's, in reality, we have to go by that, right? It's not just what I want or what the recommendations are. It's also about getting our patients, getting our viewers to follow. I can come up with a very strict guideline, but at the end of the day, if no one follows it because it's so strict, it's really a waste. So what we need to do at this point, I highly, strongly recommend that everyone should wear a mask. Definitely at least one mask, please, at least one. But if you want to, if you're able to, if it doesn't bother you, N95 is definitely a good mask to have.
So then the next question, to be vaccinated or not vaccinated?
So that's a very important one. And I understand there's, if you look it up on Google, there's probably all kinds of conspiracy theories out there. And I'll tell you, you know, I myself got vaccinated. Here on the screen, you can see this is Dr. Nadir. She's a medical director on the internal medicine side of things in American Medical Associates. And here she's getting vaccinated. So we have gotten vaccinated. I very strongly support getting vaccinated, unless, of course, someone has an allergy or someone has some other contraindication. Of course, those cases are, different. But, any regular patients, regular folks who do not have any contraindication, I definitely will recommend that they get it. And that includes some patients who've had COVID, because I actually had some patients. I had clinic yesterday. I had a couple of patients who had COVID. I saw them in a hospital, and they actually had COVID. That's, and had some kidney issues. That's how I saw them. But and they asked me, hey, should we get it? And I said the same thing to them, that, hey, listen, vaccines are still a very, very effective way to build our own body's, a response to the COVID virus. Of course, same thing I would say about the influenza virus or some other viruses. So if someone is going to be exposed or is going to be in an environment where they might potentially get exposure to a certain virus, I would definitely say they should get vaccinated. Now, again, when it comes to the body, body's response and the body trying to make its immune system stronger to fight the viruses, there are some other things that we can do also in addition to the vaccinations. Um, and And one thing that I do want to touch on really quick, and this will go back to your question, that I think one of the few things I've heard some people say there, this thing about how they might get sick or they might get the virus because they got vaccine. There's absolutely zero evidence at this point that people are actually going to get the virus from this vaccine. There's nothing like that, to my knowledge. And the other thing is that, yes, you can get some generalized symptoms from the vaccine. Yeah, I mean, you could get some myalgias, arthralgia, some body aches. Some people may get some nausea. Some people may get some headaches. I've had a couple of people get some fevers, also pretty low grade, nothing too crazy. However, those symptoms can be treated. We can treat them. And again, this goes for if someone actually got the virus or if someone had the vaccine. So these symptoms can definitely be treated. And what I think one of the things that I would like Sherelle here to go over is what are some of the things that we can do in regards to supplementing our body, supplementing our immune system, so that we can actually fight these viruses better, how we can be less symptomatic. And even if we go and get the vaccine and we're scared about or concerned about not feeling well for the next 1 or 2 days, then hey, these are some of the things we can do so that this can absolutely minimize those symptoms, so you don't feel those side effects. So Sherelle, here I'm going to let Sherelle come over here and explain some of this. So Sherelle, what do you think we can do in regards to natural therapy that could definitely help our body respond better and fight these viruses better? So I'll let Sherelle come into the screen view here.
Hello.
Hey, Sherelle. And
Hi.
Sherelle Morales, she is a registered medical assistant and phlebotomist for Vitalized Wellness programs. And Sherelle has been in the medical field for over 10 years. And she actually recently completed her certification as an EMT. She's worked with Dignity and local hospitals. And Sherelle has experience in working with a wide range of patients, pediatric, VA geriatrics, oncology, ER trauma, and internal medicine. So, wow, you bring quite the resume here. So, she's also a wife of a police officer, a mother of 2 children. So, thank you for joining us, Sherelle. And I love the expertise between you and Dr. Khan. Your company it's really all inclusive.
Thank you. Thank you for having us. Yes, again, that's Sherelle Morales. But just to touch back on bases of some things that we could do on helping treat the symptoms and such are, here at Vitalized Infusion Center, we do our IV vitamin therapies. That helps a lot with especially the vaccines that Dr. Khan was just speaking of. It helps before and post, well, symptoms of post as well. Um, our most famous one currently at the moment is our Myers cocktail. That one consists of 6 different vitamins, which also helps with the fevers, the chills, the body aches, um, all of the symptoms of the COVID vaccine and other viral infections.
So talk about that cocktail. How is that administered? What does the average person do? They come into the clinic and
Yes, so they come inside our clinic here. You can, our number is up on the website there. The Myers cocktail, they come in, they get it, and it's through an IV.
So, Sherelle, if I may interject, no, please have, if you would, I was just wondering, so why not just oral vitamins? I mean, I know that there's many brands available or we're not, whatnot, but would you like to please tell our viewers about why is it that the IV vitamin therapy is more effective compared to just taking simple oral multivitamins?
Of course, of course. So the oral vitamins there, it actually, we taking it orally goes through our GI tract. So with that being said, it does get absorbed by going through the GI tract versus if we were to do the Myers cocktail through IV therapy, that goes directly into our body and our bloodstream. So it has longer effects. It's not a short term. It does have longer effects and it lasts longer. And also it hits faster than versus the oral supplements.
great point. Dr. Khan, I'm really glad that you asked that because I was going to ask that.
Oh, I'm sorry. I didn't mean to.
Yeah, no, that's
I did
perfect.
not mean
I
to
love
take that
it.
from you.
That's perfect.
So you just come over here.
Hmm?
Yeah, go ahead. You want to tell them some more, Shira, about this, or?
Oh no, feel free.
Okay, that's
Yes.
fine. So I'm sorry, we're just kind of switching back and forth.
No,
here.
I love it. Take
Um,
your time.
So yeah, I mean, so what Sherelle was saying is correct that yes, the oral multivitamins, they're decent. However, there's a very inherent flaw in the way it's administered, and that is the fact that they are oral. The amount of absorption is very minimal. As a matter of fact, most of the vitamins that we do take orally actually go to waste. They do not get absorbed. And that's why some of these IV therapies have become so mainstream. You'll actually see many, many different companies doing it, and they're very effective. And you actually saw probably in 1 or 2 pictures back there, there's actually me myself. I got the IV therapy. This is actually when I got my vaccine. I got it, I think, before or after. It was the same day, and you'll be surprised. I got absolutely zero symptoms from it, none whatsoever. I didn't even feel weak or no myalgias. That I got the vaccine that day, and the next day I actually went to the gym both days. So it really did help me, at least. I can only speak for myself here, but it definitely helped me when it comes to the energy and basically bouncing back from some of these effects of the vaccines that might be there. And of course, when the patients are older, they might be more pronounced in that in that manner. Um, of course, Sherelle was talking about some of these different cocktails that they have. They have all these different vitamins. And here, I'll give it back to Sherelle, and maybe she can explain about some of these things about vitamin C, B12, B complexes, zinc, some of these magnesium, some of these things, if you want to, Sherelle, if you want to highlight a little bit real quick for our viewers.
Of course. All right. So one of our most popular cocktails are actually our Myers cocktail. In that, again, as I said earlier, it does contain 6 different plus additional vitamins at patient's request. Magnesium and calcium, B complex, B12, vitamin C, and also glutathione and zinc. Zinc especially is a really good one that a lot of our patients request in their bag, being that zinc does boost the immune system. And the glutathione also helps with healing from the inside, from internal out. Vitamin C is also, which is known for good immunity. It builds and it enriches the immune system with that, and especially with after the vaccine.
Okay, well, I think that's some very useful information, Cheryl. That's great. Thank you. Um, so, of course, going back to it, yeah, the glutathione helps, but at the end of the day, I think the take-home message is, yes, we all need to do our part to prevent the spread of COVID-19, and for that matter, many other viruses that could be there. Influenza is a very similar type of story. Whenever the flu season hits, it'll be a very similar thing, and definitely, if we keep wearing the masks, if we keep washing our hands, we take those measures to make sure that this virus doesn't spread, then it'll happen. And of course, if I do request and I do suggest to all our viewers that if they start having symptoms, any respiratory symptoms that are out of ordinary, and they really feel they're struggling to breathe or anything like that, they really should contact their primary care doc right away. However, what we can do at Vitalized Infusions is definitely provide some of these IVs for some of these patients. And whether they're recovering from a viral infection, because it could be a patient who was in hospital for COVID, keep in mind. It could be someone who was there for a week, 10 days, 2 weeks, what have you, and they got treatment and they're getting better, but they're not quite there yet. Okay, they're not quite there yet, and their body's just taken really its time to recover. Yeah, these IVs will definitely help. Again, it's not an antiviral. It's not going to go kill the viruses, but what it's going to do is make the body stronger so it can fight the viruses better. I think that's one of the things that I want to highlight. Otherwise, definitely, I advise all our patients to stay hydrated. Another thing that I do want to mention here, and it's important, is when we do IVs here, they do keep me in the loop when it comes to this. Reason is that there are many patients that we have that are kidney patients. They may have underlying chronic kidney diseases or kidney disease in general. They may have lower kidney function, lower GFR from diabetes, from hypertension. At the same time, we may have patients that are liver patients. So, or may have any other, underlying pathologies. So, in that scenario, many times these concentrations have to be modified so that they fit those patients' needs. We definitely want to give what is safe for the patients. We don't, we do not randomly just mix components together and just give it to patients. We do not do that. Once we have history that the patient has some underlying issues, then the staff runs it through me, and we actively modify any kind of concentrations that we need to make sure that the patient still gets the extra boost that they need, but they get it in a safe way, so that that we do not have any adverse effects on their body from this. So just another thing that I wanted to kind of highlight in regards to this.
There is
Yes,
one more
Sherelle?
thing I want to.
Go ahead, please.
There is one more thing I would like to touch bases on as well, with being that it's viral and people are feeling sick and not up to par. The one thing we do offer, and it should be known for our patients, for anybody, feel free to come in even if you're sick. We do have a drive-through service. They don't have to come inside if they're not feeling comfortable, although we do wear our PPE and we do sanitize. But through the drive-through services, you can stay in your car, and we were able to still do the IV and still treat for those symptoms and at your guys' own comfort as well.
That's great information. And I have a couple of questions.
Yes, please.
So this IV is really, so once people get the vaccine, it's probably a good idea to use that IV therapy just so that you don't have some of those side effects, or hopefully that you don't have some of those side effects. And if somebody were to come in, do they have to make an appointment? And then how long does the IV take, that procedure?
So usually most of the IVs are going to be about, I would say under 30 minutes for most of them. And if not, I think only in specialized cases, they may need a little bit more, but over 90% of the patients, all the standard IVs are going to be about, less than 30 minutes for the IVs to run. That includes putting the IV line in and getting the IV running and all that good stuff. Pretty much 30 minutes is what you're looking at. So what was the other part? So how long does it take, Em?
Yeah.
Oh, the scheduling of the patients. Yes, Cheryl, you want to answer that question?
course.
Yeah, go ahead.
So one thing also with what Dr. Khan said, we also do use the pressure bags. So if they're needing it, and depending on how well their veins are, we can administer it, and that's what helps keep it under the 30-minute mark instead of normally taking about the hour. Pressure bags do come into place, and they do help out a lot. As far as making an appointment, if you're feeling sick.
So these pressure bags make it run faster, correct?
Correct. Yes. Yeah. Pressure bags do make it run faster. And I think there is one right behind me, if you guys can see that there.
We can. I see that.
That's our pressure bag. Yeah. So
Okay.
that's what helps push that IV through into the body too, and help, get the patient in and out, being that they are not filling up to par. As far as the appointments go, if you're, again, positive for anything, or if you're just not feeling up to par and you're feeling sick and don't feel comfortable with coming in, we do ask and recommend that you do give us a call. Even if you're on your way, at least it still gives us time to prep the bag, and we can put our cones out in placement for your car to where you could park. If something happens, which we do know life happens, and you need to come in and don't have time to call, we completely understand, and we do accommodate those as well. But preferably appointment, but we definitely will do whatever it takes for you guys to come in and get your IV hydration.
So, Dr. Khan, I have another question on this. So, how often would you recommend somebody, because vitamins are a key important thing on preventing many, many different things, viruses, and just keeping us healthy. How often do you recommend coming in for an IV procedure?
So, I'm going to assume we're talking about our normal viewers, patients who don't have any underlying GI issues. There are some patients we have who've had underlying GI issues, and, some operations or whatnot, then their GI tract is not normal. Some of those patients may need to come in more often just because they have lost the capacity to absorb vitamins and many other pretty vital nutrients. So again, those cases are different. We're talking about patients who are, their GI tract is normal. They don't have any other known GI issues. I would say probably once a month is a rough recommendation. Again, this is up to the patients themselves, but I would think that once a month is most likely should be enough for most patients. Again, if someone is sick, they're recovering from COVID or something else, then obviously it can be a little bit more. And those situations are different because the body's trying to fight back. And, in those scenarios, body really can use all the help it can get. But yes, for patients who are feeling fine, they're normal. Yeah, I think once a month is or even once every 6 weeks is actually not bad. I think that's something that would be beneficial in my view.
So can the average person just come to and make an appointment and come in just to have a full workup to see? Because how do people, unless you're experiencing symptoms, we want to be proactive in our health. Would you recommend that?
Well, I absolutely agree with you on that. That yes, because many times people may be deficient in many vital vitamins and other minerals that are really necessary for the body, but may not even know it. And which is why I would say that yeah, I agree with you that it's even if someone is feeling okay, I don't think it's a bad idea to stop by and get themselves checked and see where they stand and see if some of the IVs here, some of the IV therapies can help. So again, these are IV therapies. This is not just hydration. Just want to be clear on that because there's a lot of places that do just hydration. These are proper therapies, and then they do and they're supposed to do a lot more than just simple hydration, and they do. So, but yes, I agree with you on that. Yes, it would be a good idea for even normal folks to walk in. Yes.
Well, and even with hydration, people don't understand that if you are dehydrated, you are losing, you know, vitamins and minerals out of your system and things, even just basic salt that we need in our system. It's so critical to keep our bodies running the right way.
No, you're 100% correct that hydration is vital. I mean, I'm nephrologist, so I'm always, very much in favor of keeping ourselves very well hydrated because kidneys really love hydration. They really love fluids. So, kidneys that are getting decent amount of fluid circulation, they're usually pretty happy kidneys. So, well, overall, yes, absolutely agree with you. Again, if someone has some health condition that doesn't allow it, those people are excluded from this comment. But uh, all our normal patients, all our normal folks who don't have underlying cardiac issues and stuff like that, absolutely, they should be drinking good amount of water. They should definitely be keeping themselves hydrated. And this is definitely an added layer of hydration to everything else that they're doing. Indeed.
Well, and I know that during the pandemic, sometimes people were kind of afraid to kind of get out there and go see their doctors. Telemedicine came into place. But I'm also a firm believer that they really do need to have these conversations with their medical professional, with their doctors, and talking about that because we don't want them not to go to those appointments. That's really critical.
You're absolutely right. I think, as a matter of fact, we are seeing many patients who were reluctant to come in during the, when the COVID was really hitting the country with full force, and now we're seeing many of them are slowly starting to follow up again. And, it turns out a lot of these patients were having all these complaints during this time, and they didn't even address them. And many of them are now requiring pretty extensive workup because things have gotten to a point with some of these patients where really a lot more has to be done now than it would have been needed if they had approached their physicians in time. So yes, absolutely, I agree that they should be reaching out to their physicians so that things can be taken care of in a timely manner and before things get worse, because many times you wait too long and then the amount of treatment necessary may need to be rather extensive, and if they had come in time, very minimal treatment would have been enough. So yeah, agree with that, absolutely.
So, can somebody just come to you, or do they have to have a referral from their general physician?
So, I mean, I do nephrology. Definitely, patients can. I think part of it depends on their insurance plans. Some insurance plans they're okay with it direct. Some of them on referral. Really, that depends on that. From my standpoint, anyone is more than welcome to come in anytime, if you ask me. We also do, of course, primary care at American Medical Associates, so it doesn't have to be just nephrology. We have Dr. Nadir here. We have many other docs here, as a matter of fact, and they're all very geared towards what my mindset is. And I think we were supposed to be having Dr. Nadir here today. I'm not sure if we're able to. Is she not? Oh, she's okay. So seems that she's really busy with the patients right now, so we're unable to. But oh, it happens. So, but yes, we definitely have because I was internal medicine for a long time, so I'm very aware of what a vital role it is for an internal medicine doctor to play to make sure that people stay healthy. But yes, anyone is more than welcome to come to me anytime. Otherwise, if they don't have nephrology issues, then definitely our primary care practice is here to address whatever it is that they need.
Can you tell everybody where your offices are located?
So yes, our office is in Chandler, at the border of Chandler and Gilbert area, for that matter. It's right at the cross street. It's at Cooper and Chandler Boulevard.
Mhm.
There's a Walgreens there. It's right next to the Walgreens. You can't miss it. So yeah, the office is right there, and right next to the office is the infusion center, which is where we're sitting right now. And that's where all the IV infusion therapies are given here at the infusion center.
And we will also post how people can get in touch with you on your website as well as a phone number. And Dr. Khan and Sharir, I just want to thank you because I wish people would have more frank conversations with their doctors, just as I don't want doctors to be threatening to people. I want them to know who you are, and you're really there to educate them, and it's all about their health and what's the best course of action for them.
Well, that was very kind of you to say that, but I agree with you 100% that there have to be these one-on-one conversations, and I think it's important that people see their physicians as their friends, because that's what we really want to be, you know, and not as someone that they're scared to see or scared to talk to, because if we don't know, we can't help them. And and yeah, go ahead, please.
You are so right. And And they really are. I love that. Your physicians need to be your friends. And that's the words that we need to live by, because we all want to stay healthy and grow to a very old, ripe age, right?
Amen to that. Amen to that. I agree. Yes, absolutely. Yes.
All right.
Staying healthy.
Well,
Yes.
well, thank you so much for joining us. You have been a fountain of information, and I really appreciate your just very candidness and the conversation that we've had, because that goes a long way. And I feel like I have a new friend in you.
That's
I've
very
learned a
kind of
lot
you.
of new
That's
things.
very kind of you. You're more than welcome to call us anytime. Call me anytime, please.
Well, thank you again for joining us for today's series, Strategy for Success, Preventative Measures on Prioritizing Your Well-Being. Thank you, Dr. Khan with American Medical Associates, as well as Cheryl Morales with Vitalize Infusion Center. Thank you so much for joining us. And for more information, feel free to reach out to the doctor's office directly, and we will have that information for you, those that are watching, directly emailed to you. So thanks again, and join us next week for our regular Strategy for Success seminars. Thanks again.
Thank you so much for having us. Thank you.